I work in a warehouse, drive forklift, I do shipping and receiving, so I fill orders and I put stock up in the warehouse. I've been with this company for 26 years, 26 and a half.
So what kind of insurance do you get?
I have health insurance, is dental, vision, medical, and that is included some life insurance and disability, and I have to pay a little extra for long-term disability. They provide some short-term disability insurance.
What kind of a plan do you have?
Our health care plan has a $4,250 deductible, and they let us use $750 per family up front, and then when that's gone, so like when we go to the doctor, the office call is so much, and then the insurance company has a little lesser rate, and then when that's what's deducted from our plan, and then when that $750 is used up, that money you borrowed, you get to put back on your deductible. So that's what makes our deductible like $4,250 per family. That's for me and my wife.
How dramatically has your health care coverage changed over the years?
Oh, it's gone kind of nuts. I mean, you used to paying so much, and my wife's not able to work. I'm the sole provider, and after when you go to the doctor's office, you got to pay that $65 office call, where before you only paid a $15 copay.
Can you sort of give us an overview of like what's happened to the kind of coverage you used to receive compared to the coverage that you receive now?
Cost-wise, gosh, it's just totally different. I just didn't think much about it. Now, to pay for our prescriptions and still buy groceries and all the other bills, the gas in the car now, you just have to kind of cut back, and you just don't go and do the things you used to do. We're not able to we used to spend a lot of money on our grandkids, and we kind of have to cut that back to pay these office calls to the doctor and such.
Do you ever feel that it's like pushed you to the point where maybe you don't go for an exam that you should get? Maybe you don't go to the doctor when you should?
Well, I know last year in November and December, I asked the wife, I said, "Man, you really don't need to go in for a pro time. I mean, you have to do that every 4 weeks, and that's what the doctor wants. But man, let's skip it here in December, and that'll be a little bit. You won't have to just don't make any office calls to the doctor in December, so we'll have a little extra money at Christmas and stuff." And she said, "Okay, I'll do it." And then when she went in January, the doctor says, "You haven't been in here in 6 weeks. What happened?" Well, we just didn't come in.
What about you yourself? Do you find that you avoid medical care because of the cost?
I don't go to the doctor. I haven't gone to the doctor in years because I haven't had any problems. And I just don't go. And my wife and my daughter said, "Hey, you need to go get a physical." I said, "No, I don't. I feel just fine." And then, gosh, I got a year and a half ago, I got up one morning and my stomach hurt so bad, I was just screaming with pain. And I couldn't really walk, couldn't really sit, couldn't lay down. And I told my wife, I said, "Call the doctor." And when I tell her to call the doctor, her and my daughter both panicked because there must be something seriously wrong. And I went to the doctor, and he poked and punched on me, and he said, "You got diverticulitis, man." And my wife, she pops out in the middle of the conversation. She said, "Well, he needs a physical. He hadn't had a physical in 20 years. Well, we're not going to do that right now. He has enough problems right now. We'll do that physical later on." So I was supposed to go back in 6 months to do the CAT scan, and I said, "No, we'll do it later." Because that thing costs money. And I said, that CAT scan cost us $1,200 because we hadn't met our deductible yet. She said, "Well, we'll just make payments. They're just going to have to take what we give them, and as long as we pay them faithfully every month, well, they won't say anything. They'll be all right." And if they fuss about it, we'll just say, hey, we're doing the best we can. So after about a year and a half, they really hammered me. Said, you've got to go in and get a physical. And I said, okay. So while we're in there getting our physicals, and he came to me and he did mine, he says, oh, by the way, he says, we're supposed to have done a sonogram on your kidney about 6 months ago, and you haven't been in. How come you don't come in to see me? And you don't like me? And I said, no, you cost too much money. And he kind of laughed. And he says, well, he said, we're going to do the sonogram. I'll schedule it, and you can come in later. So they scheduled the sonogram for the next day, and I went in, and they did it. And a couple of weeks later, got the results back, and he says, well, that cyst on your kidney has gone from 3 centimeters by 3 centimeters to 3 by 5. So we need to take another look at that. We need to do another CAT scan. And I said, man, you know what that costs? And he says, no, I don't. But he said, don't worry about that. This is something we need to do. They did that CAT scan, and they come back a couple of weeks later and says, you need to go see a urologist. I don't like the looks of this. So I go make an appointment with the urologist, and I go in there, and all my paperwork filled out, and they hand me the little cup for the urine test, and I go in and do that, and I come back, and they put me in this room, and I sit in there, and here comes the doctor in a few minutes, and he comes in, and he says, how you doing, Mr. Gaston? I said, well, evidently not too good if I'm here. And he said, oh, it's not that bad. He said, why didn't you have to have a CAT scan? And I told him the whole story, that I had this diverticulitis, and they did the CAT scan, and that's how they found it. And then they wanted to do another one because they thought it was getting larger. And he says, yep. He said, it is. And he says, you got cancer. And I said, oh, wow. I said, what the heck is this going to cost me? And he said, don't worry about the cost. He says, this is something that needs to be done. He said, if I hadn't had that CAT scan done, he said, this would have gone undetected. And he said, another year from now, you'd have been a mess. He said, there probably wasn't nothing I could do for you.
Sounds as though you may have somewhat put your, life on the line, delaying scans because of the medical costs.
Yeah. I thought, well, I'm all right. I don't have any pain. I don't feel anything. I'm all right. Well, at this point, there is no pain. But it's a good thing they did find it when they did. And now it's supposed to be contained to this kidney, but man, this is going to cost buku's money. And I've stayed awake at nights. For a while, I stayed awake at nights tossing and turning about the cancer thing, and I finally got that under control. I understand that. And I said, well, that's not so bad. It won't be no big deal. But how in the world am I going to pay for this? I told my wife, I said, man, this is going to take our life savings, everything we've saved up all these years for retirement. Man, I'm just 5 years away. I was going to work 5 more years, and we're going to retire and let Medicare and all that stuff take care of it. Maybe pick up a little supplemental insurance to cover what it doesn't care, like a lot of people do. But man, this is going to wipe us out. She said, no, it's not. We're going to make payments to them just like the rest of them. If they don't like it, that's the best we can do. They're just going to have to accept it. My wife had pneumonia and was in the hospital, and we owed, after she got out of the hospital, she was in there 15 days, and I don't know, I think that hospital bill on our part had added up to about $10,000, something like that. We had to pay, and I mean, I think that bill was $70,000-$80,000. And man, when the insurance paid all but of it, that was pretty cool. But not, well, we'll pay them $50 a month, if we can. We'd kind of, probably like everybody else, we kind of got into a little credit card debt. I had a couple credit cards that we had kind of high payments on. So I just talked to the wife. We sat down, we talked about it one day, and I said, well, let's see about borrowing something off of 401k, and they'll let us pay that back to them. It'll come out of my check. It's my money, and we'll get enough money off that to pay off the hospital bill, and we won't have to listen to them call you every month and saying we need more than $50. We need $150 a month out of you to pay this off. And it was, it's just, you get to where you don't answer the phone.
How do you feel about what's happened? Do you feel sort of squeezed in the middle? Just from a personal perspective.
How do I feel? Gosh. Squeezed, I guess. I don't know. You just live your lifestyle changes. You don't I haven't been back to see my brother in New Mexico in, gosh, it's been almost 15 years. That's 700 miles away. You just don't go anymore because you gotta save your money to pay on medical bills. I just hope they keep accepting small payments. If they start wanting some outlandish payments, man, here we're gonna have to dip into maybe my 401k. I've done that before, but gosh, I can't do it now. I did it once before, and I paid it back. I borrowed about $10,000 off my 401k, and I paid it back like $50 a month, come out of my check before I saw it. Now I don't have that kind of time to pay this kind of money back, so they're just gonna have to wait till I can start drawing some of it out and maybe make ends meet that way.
Well,
I have some some savings, but it's taken me all my life to save that up. I have some retirement money that I got to roll over in a different plan, and that's not that much money. And especially you start taking out $4,000 or $5,000 at a time to meet a deductible. I made these debts fair and honest, and man, I'm going to do what I can to pay. I'm going to pay them back, but it's going to be a little bit at a time. I still got to buy groceries. I still got to buy gas for the car. I got utility bills to pay. I'm glad I work for an employer that has an insurance plan. There's a lot of people out there that don't have any. And I know people that they're buying in that have to buy their own insurance, and gosh, it's probably 10 times what I pay. But still, my problems to somebody else are probably not that big, but to me, they're my problems, and they're big. I mean, here I'm going to have to come up with some money to reach to pay this deductible on these doctor bills, and they're going to go way past the deductibles. So we're just going to get by.